is there emerging or longer term evidence? And I think, a lot of people who have really good experience with the skeletal muscle relaxants would probably argue this point, but when you look at maybe not the best or most robust quality evidence, in my mind, the best of what we have in terms of using these agents longer than, say, their FDA labeled indication might be, is really for the medications like cyclobenzaprine, which has some fairly good longer-term data in fibromyalgia, baclofen, although unfortunately most of our longer-term data with baclofen is actually in intrathecal delivery. And then we do have some smaller yet randomized controlled studies looking at tizanidine's efficacy in terms of some of the different neuropathic pains, as well as, believe it or not, chronic daily headache. When you're thinking about potential non-pharmacologic modalities for the treatment of, say, spasm, spasticity, or even chronic musculoskeletal pain, I think that we frequently overlook transcutaneous electrical nerve stimulation, and not all TENS or transcutaneous electrical nerve stimulations are created equally. Really, it's kind of like calling all soda Coke. There are specific different types. Some can be much more readily useful for patients who are experiencing pain due to spasm, such as neuromuscular electrical stimulation, and some of the different devices will have that. Of course, heat and ice are still the old tried and true. Usually for an acute injury, we're talking ice. We typically don't want to put heat on an acute injury for 48 to 72 hours because we don't want to make the inflammation worse. Acupuncture is definitely something that is growing in terms of its evidence base, and I think more and more people are turning to some of these alternative modalities for pain treatment. There are specific points that are taught to medical acupuncturists as well as even auricular acupuncturists that specifically are there for whole body muscle relaxation. And then you can also target certain areas of the body and certain muscle groups as well. There are some small studies that have largely been debunked, but there's still quite a following of people who believe that guaifenesin has some muscle relaxant properties. And if you look at the chemical structure of guaifenesin, it does look fairly similar to one of our skeletal muscle relaxants, methocarbamol. Right now, the best evidence we have for cannabis is specifically around spasticity and multiple sclerosis. There's also some very good data that even the American Academy of Neurology supports in their position statement from several years ago.